Erica, I'm Mackenzie. I'll be your nurse today. Nice to meet you. We're just going to do a thorax and lung exam on you. Okay. So right now, I'll just have you breathe normally. I'm going to take a peek at your chest, make sure there's no abnormalities. Is that okay?
Yes.
Perfect. So just go ahead and breathe normal. Everything looks good. Seems to be symmetrical bilaterally. And just turn to the side for me. Chest expansion looks great. And then turn all the way this way, please. And I'm going to have you take a deep breath and exhale. Okay, good. So chest expansion is symmetrical bilaterally. Seems strong and everything's good.
Okay.
Okay, and now I'm just going to, I want to feel for fremitus or any sort of normal vibrations. So when I say 99, I'll have you repeat after me if that's okay. So 99,
99,
99,
99,
99.
99,
Great, and then turn around. 99,
99,
99,
99,
99,
99,
99.
99.
Thank you, and you can turn back toward
Okay.
me. And now I just want to listen to your lungs, make sure they sound the way they should, just air-filled, not filled with fluid
Okay.
or anything bad. Okay. Thank you. Turn around for me. Thank you. And thank you, Erica.
Okay.
Okay, now last I'm just going to take a listen here with my stethoscope. So when I tell you to take a deep breath in for me, if you would, please.
Okay.
And then we'll get you out of here, okay?
Perfect.
So deep breath in. Thank you. And another. Thank you. And then please turn around. Deep breath. Thank you. I'm going to go up under your shirt if you don't mind. Deep breath, please. Thank you. One more. Deep breath. Thank you. Here. Thank you. Thank you. And then I'm going to get the right middle lobe over here. Deep breath in. Thank you. All right, lung sounds are clear. I don't notice anything abnormal, no wheezing or crackles or bronch beat or anything of that nature. So everything looks good. Thank you so much.
Thank you.
Have a great day. Hi there, Megan. I'm Mackenzie. I'm going to be your nurse today. We're just going to do a cardiac exam on you. Is that okay?
Mm-hmm.
All right, so I'm just going to take a peek at your chest. I want to make sure you can see everything. Normal heartbeat. I'm just going to feel here. I want to make sure there's nothing abnormal, no lifts, heaves, or thrills, any sort of vibrations, because that might be indicative of something abnormal. But you feel pretty good. And then I'm going to feel your apical pulse. Pardon me here. Right under here, it's the mid-clavicular line, fifth intercostal space. Okay. And I'm going to listen to the heart sounds here. Thank you. Okay, so you can just breathe normal. First, I'm going to do the aortic. And now your pulmonic. Tricuspid. And the mitral valve down here. Alright, nice and strong. Everything sounds to be regular and symmetrical as well at each point of the heart. So if you wouldn't mind just lying down, be careful with your head here, and then turning onto your left side for me. Oops, I still need this. So I'm just going to listen on this side and make sure there's no abnormalities. I don't hear any S3 or S4 sounds. And I'm just going to switch my stethoscope to the bell side for that. Reach over to here. You're okay. Alright, everything sounds good there. And now you can keep just lying flat on your back for me. And I just wanted to, ooh, are you okay? I was going to take a peek at your jugular, make sure you have good jugular pulse, or nothing abnormal, no venous distension in the jugular here of your neck. And everything looks good. I can actually barely see it, but that's a good thing. You don't want any bulges or anything. And so now I just want to fill your carotid artery here. Great. Pulses are strong and equal. And I'm going to take a listen there. Assess for any bruit or any abnormal sounds here. Again with the bell of my stethoscope. Okay, and then you can go ahead and sit up for me and I'll have you straighten your legs out, please. And I just want to check your pedal pulses. You have good temperature and coloring in the feet here. So first I'll do the pulses here on the top. And they're strong and equal. And then the posterior tibial pulse, same here. Strong and equal as well. And then I'm just going to lift your hands up a little bit. And your coloring seems good. There doesn't seem to be any edema. Temperature is good on both sides. I don't really notice any abnormal bruising or veins or anything of that nature. So you look good to go. Seems like your cardiac system's working properly. Hi Megan, my name's Mackenzie. I'll be your nurse today. I understand we're going to do an abdominal assessment on you. So if you don't mind, I'll just have you lie down and watch your head for me though, please. Okay, and then if you don't mind, I'm just going to unbutton your shirt here so I can get a good look at your tummy. Just put your knees down for me. There you go. Nice and flat. Thank you. Alright, I just want to take a peek at your tummy, make sure you don't have any scars I see, you have a mole here, everything else looks good, no masses, no abnormal bulges or anything that I would see any sort of growth or abnormalities, tumors. And then I'm going to take a listen here at your bowels. I want to make sure everything sounds normal. Normally I would do this for much longer, but for the purpose of this demonstration, I'm just going to show all 4 quadrants. Okay, and I went in the flow of your digestive tract, and everything sounds normal to me. I don't hear any abnormal sounds, and I do hear normal bowel movement sounds. And I'm going to check and make sure we don't have any renal artery bruits or anything abnormal of that nature. And good. Okay, and now I want to feel and percuss your abdomen, and I want to check for different sounds of either dullness or tympany. So you'll feel dullness over major organs such as your liver here, and then I'll feel or hear tympany over like a more empty organ such as your stomach. And so in the tract of your organs, here we have the cecum, and then we have your like appendix and your liver and your gallbladder, and then we move over the tummies in this area, your stomach, and then the spleen, and then you have 2 ovaries, I presume. Do you have both ovaries? Yes, and then your bladder, urinary bladder in the middle. And also while you're lying down, I can see your aortic pulse right here in your belly button. And then I'm just going to percuss here. So over that liver there, I heard dullness and tympany there. Everything sounds good based on percussion. And now I'm just going to feel lightly, make sure, please let me know if you feel any pain or discomfort. Anything? Okay, I'm going to push a little bit harder on you now, and please, same thing, if you feel like anything hurts, let me know. And I don't feel any abnormalities in your right upper quadrant. If I could feel your liver edge, I'd be a little concerned. And then same in the left upper quadrant, if I could feel the spleen or anything of that nature. I'll close up your blouse here and just have you sit up for me. Are you all right? And if you could just turn a little bit to your right, since I'm on this side, thank you so much. And I'm just going to percuss on your back. If you feel any sort of pain, I want to make sure there's nothing going on in your kidney or urinary tract, any sort of infection or anything. I would notice if there was pain from when I do this. So please let me know if this hurts.
No.
No? Anything?
Nope.
All right, you seem to not have any infections and everything seems to be working. Thanks so much. Have a good day. Hi, Erica. My name's Mackenzie. I'll be your nurse today. We're just going to do a neurological exam. Okay, so I'm going to start and test cranial nerve 2 and your visual acuity.
Okay.
So I'll hold this 14 inches from your face. If you can cover one eye and then read the lowest line possible.
A-E-I-O-U.
Okay, and then take a blink and cover the other eye. Same thing.
A-E-I-O-U.
4, and 6. And so just follow this pen for me with your eyes without moving your head, please. So we'll go. Okay, and now I'm going to shine this light in your eyes. I want to make sure that your pupils are equally reactive to light, and then also I'll test accommodation at the end. So when I come, so just look straight here at my face. Okay. Thank you. And now here I come in the middle. Alrighty. So pupils equally reactive to light. Everything looks good there. Just going to take a quick peek while I do that. Your eyes look good. There's no puffiness. The sclera is white. Conjunctiva is a nice clear pink color, and everything looks good there. And then I'll have you stick your tongue out, and then I'll have you say ah. All right. So tongue is midline, uvula looks good, everything's okay there in the mouth. Now I'll have you shrug your shoulders up against the resistance. Great, cranial nerve 11 working perfectly. And then look that way, and then push against my hand. Thank you. And then same thing. Thank you. Okay. And now I'm going to have you put your hands out like this for me. And now I want to differentiate for pain and then light touch as well. So this is light and this is pain.
Okay.
So if you close your eyes and tell me which is which.
Like,
Do that to both hands and then on the tops of both feet as well. About the knuckle here at the base of the thumb. When this stops vibrating, you tell me, and if I feel it at the same time, then that's everything's normal. And I'll do that to both hands, and then right here, same on the foot. Now while I'm down here, I will test for a Babinski reflex. Abnormal finding would be if your toes fan out. If your toes curl in a little bit, that's completely normal. Okay. All right. So good. There's no abnormal findings there. And then if you could just touch your fingers to your thumbs. Great. And then arms out in a T. And now touch your nose with one finger. And touch your nose with the other. Amazing. And now I'll just have you walk that way normally. Great. And when you turn around and come back, please walk heel to toe. I'm testing your gait, looking for any imbalances or anything, any abnormalities in the feet, which you don't have. Lastly, we'll do your Romberg's exam. And I'll have you just close your eyes. And there's no abnormal sway or drifting, so that's good. And now for your pronating drift, please stick your arms out, palms to the ceiling. Close your eyes. And then after 10 seconds, I just want to make sure that there's no pronating drift on one of both arms. Usually works. Everything looks good in your nervous system. Have a great day. Hi Megan, I'm Mackenzie. I'll be your nurse today. We're going to do a musculoskeletal assessment on you. So I'm going to start with the range of motion on your upper extremities. I'll begin with your neck. I'm just going to touch here, so please don't mind my cold fingers. And then if you could just go chin to chest. Oh, thank you. And then backward. Great. And now if you can just look one direction and look the other. And now ear to shoulder. Great. And ear to shoulder. Feels good. Did it hurt or anything like that? Okay. Good. Now put your arms out straight. We're going to do the range of motion of your shoulders. So rotate back. You can do it one more time for me, then go backward. Great. And forward. And I'll make sure I palpate on this side. Backward. And forward. Perfect. Okay. Now same with your wrist. If you could go outward, inward, and outward. Either one. It doesn't matter. Thank you. Okay. So range of motion looks good there on the wrist. And now, while you have your arms out, if you could just pull up on my hands, great bicep strength, and then push down. Triceps, good job. And now, if you could grab my fingers with your hands and just squeeze nice and tight. Now I'm going to move down to the lower extremities. You can go ahead and lie on your back. If you need to scoot up, you can. And so, for the sake of time, I'm just going to do it on this one side if you can straighten your legs, but you would do it on both. So for the hip, I'll touch your hip here, and then if you just lift your leg. Great, and you can go up and down. Perfect. And then if you can touch this foot to your knee, and I will abduct outward and adduct inward. Okay, and now same thing, I'll lift your leg here on your knee, just bend your knee the best that you can. Thank you. And there's no cracking, any pain, not hear anything abnormal. Okay, I would do that on the other side. You can go ahead and sit up for me if you don't mind and come to the edge of the seat. And then for your ankles, if you could rotate them outward and inward. Now we'll do the strength on your lower extremities. So I'm going to have you pull backwards on me, and that's your hamstring strength. And then I'll have you push up against my hands, and that's your quadriceps strength, which is very strong. And now for your feet, we're going to do plantar flexion of your feet. So I'll go ahead and have you just pull up on my feet, so kind of like toes to the nose there. So everything looks good.